Hi, thank you for having me. I'm Alex DeLeo. I'm a PGY4 resident from the University of Florida. And today I will be presenting our work in progress that's been done in collaboration with the ROECSG GME working group called Learning the Ropes. And the goal of our project is to create workshops to teach residents how to evaluate treatment plans. So as we know, radiation oncology has, it's important for us to be able to evaluate treatment plans. This is a key component of our practice, but multiple studies and needs assessments have shown that many residents and new attendings don't feel comfortable with plan review. And a lot of that is due to inadequate exposure during residency training. And insufficient experience with plan review has been also associated with a challenging transition to independent practice. Although there are some tools that are available to help teach plan review, ultimately the resources are limited. So what that means is that the primary responsibility of figuring out how to teach residents to perform plan evaluation lies on the individual residency programs. Their approach may involve on-the-job plan evaluation during their rotations, educational simulations, didactics, and/or an elective rotation in dosimetry. But as we know from a national survey of residents, this varies across programs. So there are some notable examples of resources that are widely available, such as CD-CHOP, which is an easy to remember acronym for a systematic approach to reviewing treatment plans. Some of the material in the introductory lectures for IROC include a plan evaluation. And then of course, there are the Meet Me in Treatment Planning videos available on the ASTRO website, which are really popular too. Of course, with what's available, there is room for improvement. So first, I think we need to be making more resources that are available to residency programs. It would also be beneficial if we agreed upon what the foundational principles are that residents need in order to master the skill and then perform it independently. We need to give residents the opportunities to evaluate suboptimal plans. And besides that, the also opportunity to evaluate plans where there isn't a perfect solution and that compromise is needed. We should also be providing residents with the tools that they need to request for the changes to improve the treatment plans. I was excited to learn that there is an interactive tool in development in Canada that addresses a lot of these needs. And so it's a library of curated cases with initially plans that were deemed clinically unacceptable. And then, as that's an example on the top left right there, the program allows the user to speculate about why the plan was not accepted and then enter their responses. And it ultimately shows them an answer key for why it wasn't accepted with a comparison of the plan that was accepted as shown on the bottom left. As far as I know, unfortunately, it's currently not available for everybody to use and external validation is pending. All of this led us to discuss during the GME working group meetings what to do about plan evaluation education. And ultimately, we decided to create a series of workshops that approaches plan evaluation in a disease site-specific fashion. So we're using both residents and faculty members that are experts in order to create the material for the modules in collaboration with dosimetrists and physicists. Each workshop contains didactic material followed by interactive cases to engage the participants. And the goal is to pilot this in a manner similar to IROC, where we provide the teaching material and associated instructions to the programs, and then they integrate it into their education as they see fit. We do recommend that the relevant disease site-specific expert be the one to host the workshop so that they can interject with their opinions and how they approach plan review. To start, we plan on creating workshops for the following core disease sites: breast, lung, head and neck, and gyne. And then we'll pilot them at the interesting programs and administer surveys before and after completion of all of the workshops for the residents that have subjective and objective portions. And the post-workshop survey would also be repeated 3 months later to evaluate a longer-term impact. All of the modules will be created from the same template in order to maximize consistency and to emphasize the common themes between the workshops and plan evaluation. The goal is to discuss and to practice evaluating how to approach different planning techniques, evaluating target coverage and dose heterogeneity, both in the context of a graphic plan as shown on the right and with numerical representations. Trade-off situations primarily between achieving target coverage and meeting OER constraints, and suboptimal plans focusing on ways to improve them. This slide is taken from the current draft of the workshop for lung cancer. And in this example, you have a plan for a patient with locally advanced non-small cell lung cancer where you think that the mean esophagus dose is too high. In talking to the dosimetrist, they think that they wouldn't be able to reduce the dose further without sacrificing PTV coverage. The point is to demonstrate a trade-off situation. And within the case example, we go through multiple ways that you can approach that trade-off, with the picture on the right demonstrating what a plan may look like if you prioritize sparing the esophagus at the expense of PTV coverage. Of course, our program does have some limitations. So even though it's intended to be integrated into residency programs education, of course, it'll require additional time and effort on their part in order to deliver the workshops. The cases are limited in number, and it doesn't really offer hands-on experience with navigating the treatment planning system. And it's also not intended to replace involving residents in daily plan evaluation in the patients that they're treating. The point is to offer a foundation so that they can improve their confidence and their proficiency in the skill. So the next steps to progress the project will be to finish the material for the workshops and the associated teaching guide, finalize the surveys, sign up programs that are interested in participating, and then of course actually implement the pilot. So thank you everybody for having me. Thank you for the GME working group, and a special thank you to my mentor, Dr. Young.